Good day everyone. Today I am going to discuss about cystic fibrosis. So, let's go.
Cystic fibrosis. Cystic fibrosis is an autosomal recessive genetic disorder that causes exocrine glands or secretory glands that produces mucus and sweat to work incorrectly. It is most common fatal autosomal recessive disease among Caucasian or a person with European origin. This disorder mostly affects the lungs, pancreas, liver, kidneys, intestines, and sex organs. Now let's focus on how this disorder affects the lungs or the respiratory system. The mucus that is produced in the body becomes thick and sticky. Instead of lubricating the lungs and other organs, it clogs the airways in the lungs and the ducts, most frequently in the pancreas and liver. As mentioned earlier, cystic fibrosis is a genetic disease. This means that it is inherited. A child will be born with cystic fibrosis only if they inherited one cystic fibrosis gene from each parent. But a person who has only one cystic fibrosis gene is called a cystic fibrosis carrier. For better understanding, here's an example. Each parent carry the recessive gene of cystic fibrosis, the small letter C, which means they are heterozygous, so they have capital letter C and small letter c. 1 in 4 of their children is expected to be homozygous for cystic fibrosis and have the disease. Using a Punnett square, this will be the distribution of gene. 25% chance of being normal, 50% chance carrier and no symptoms, and 25% chance that one of their children would have cystic fibrosis. The pathophysiology. Cystic fibrosis is a genetic disorder that causes mutation and dysfunction in cystic fibrosis transmembrane conductance regulator, or CFTR. The CFTR gene makes a protein that regulates the movement of salt and water through the cells. If there is a mutation or dysfunction in the CFTR gene, there will also be an absent or abnormality in the CFTR ions, specifically the proteins across epithelial cell membranes. This will cause depletion in the airway surface liquid. Airway surface liquid is essential for healthy function of the epithelium. It is composed of mucous layer and periciliary layer, which are important structures in defense against infections. The mucous layer is secreted from mucus-producing cells. And because of cystic fibrosis, the mucus layer will be thick and sticky, which will result to defective mucociliary transport, or the transport of mucus layer by the movement of the cilia. This will lead to mucus accumulation, which will result to damage in airway and lung tissue due to airway inflammation and infection. Signs and symptoms. The pulmonary manifestation of cystic fibrosis includes productive cough, wheezing, hyperinflation of the lungs, and obstructed airways. Productive cough can be noted through the report of the client, or the client exhibits expectoration of thick mucus from persistent cough during physical examination. Wheezing is a high-pitched sound during exhalation upon auscultation. It usually occurs due to narrowing or obstructed airways. Hyperinflated lungs are larger than the normal lungs as a result of trapped air. Obstructed airways can result to abnormal breathing patterns such as dyspnea, while the upper respiratory manifestations of cystic fibrosis includes nasal polyps and sinusitis. The physical assessment includes assessing the respiratory status, noting the rate, rhythm, and quality of breathing, and auscultation of the lungs. Also, note the clubbing or widening around the tips of the fingers and toes due to poor oxygenation of tissues. Don't forget to assess for signs of infections. Monitor temperature, note cough with or without sputum, and obtain sputum culture and sensitivity. There are two tests commonly used to diagnose cystic fibrosis: a sweat test, which measures the amount of chloride in sweat, and a genetic test, which detects chromosomal mutations associated with the disease. Other diagnostic procedures include prenatal or preconception testing and newborn screening. Sweat test is still the only practical laboratory procedure available for diagnosis of cystic fibrosis. When properly performed, the sweat test is very reliable. A sweat test measures the amount of chloride, a part of salt, in sweat. And as I mentioned earlier, that a person with cystic fibrosis has a problem in regulating the movements of salts and water through the cells, which means a higher concentration of chloride or salt in sweat. Moving on to medical management of cystic fibrosis. For acute airway exacerbations, aggressive therapy involves airway clearance and antibiotic based on results of sputum cultures. Airway clearance treatments may be used 3 to 4 times per day. Airway clearance treatment includes manual postural drainage, chest physiotherapy, high-frequency chest wall oscillation, autogenic drainage, and other devices that assist airway clearance, such as PEP masks and flutter devices. A nebulized medication, such as Dornasi alpha, is given to degrade the large amount of DNA that accumulates within CF mucus. This agent helps decrease the viscosity of the sputum and promotes expectoration of secretions. Antibiotic treatment is given when there is an infection, since people with cystic fibrosis are susceptible for infections. This includes 2 intravenous fluid antibiotic, oral antibiotic, and inhaled antibiotic. Anti-inflammatory agents may be used to treat inflammatory response in the airways. These include ibuprofen. CFTR modulators are a new class of drugs and help to improve functions of defective CFTR protein. This includes ivacaftor and lumacaftor. As the pulmonary deterioration advances, supplemental oxygen is used to treat the progressive hypoxemia that occurs with cystic fibrosis. Some of the nursing managements include chest physiotherapy, such as postural drainage, chest percussion, and chest vibration. Breathing and coughing exercises are also practiced with the client. Reminding patient to reduce risk factors associated with respiratory infections. Patient education about early signs and symptoms of respiratory infections, and emphasizing importance of adequate fluid and dietary intake. Some of the nursing diagnoses of cystic fibrosis are impaired gas exchange related to obstructed airways due to accumulation of mucus as manifested by dyspnea. Infected airway clearance related to accumulation of mucus as evidenced by wheezing, infection related to invading microorganism as evidenced by fever. Nursing interventions are encourage increase in fluid intake, the suctioning of the secretions as necessary per facility protocol. Thick mucus in the lungs or weakened muscles make it difficult for patients to expel secretions. Suctioning may be required. And of course, administering medications and supplements appropriately. Applying the 5 rights of the patients in drug administration. Performing chest physical therapy or vest therapy 2 to 4 times per day per facility protocol. And provide education for home treatment and resource information for patients and parents.
That's all for today. I hope you enjoy and understand the topic. Bye!